Hello, everyone. Tom, thanks for inviting me back for a second year. First year, I can't have been so bad. I'm from the Open University, and I'd like to just preface my comments about the HEAT programme with the fact that the Open University has, for nearly 45 years, been involved in blended learning, in distance learning, in work-based learning, and we're considered to be a leading expert in the field, and we've supported millions of students over the years through our programmes. And what we've done is we've brought our learning and we've applied that to our work in international development. And we do international development across a number of sectors, but I'm here obviously to talk to you today about the health sector and about HEAT. HEAT's an innovative programme created by the UK Open University, working with governments and partners in sub-Saharan Africa to help transform health education and training. Launched in Ethiopia in early 2011, by the end of this year, over 6,000 health extension workers will be using the HEAT content to improve their knowledge and their understanding of healthcare. The government has plans for over 20,000 students to be trained using HEAT content and with the practical skills training developed by the World Health Organization over the next 4 years. We're now in discussion with countries across sub-Saharan Africa about helping the region train the 1 million additional health workers that we've already heard mentioned several times this morning needed to reach the Millennium Development Goals. The HEAT model has even wider potential. Health trainers from India, Bangladesh, and Pakistan have approached us to talk about how HEAT can help to transform their health education programs for frontline health workers. And I've had emails since posting about HEAT on the HIFA 2015 website from people who are training health workers in India, in 6 or 7 other countries in sub-Saharan Africa, and in South America, saying that they found the HEAT content online. And although it's been designed for Ethiopia, they're using it to train not only frontline health workers, but also to train nurses, midwives, paramedics, and doctors. HEAT is transferable, it is replicable, and it is scalable. HEAT is helping to make health not just a right, but a reality for those most in need and those in most hard-to-reach areas. These are bold claims, and I'm going to spend the next 6 or 7 minutes saying why I believe that we can deliver using the HEAT programme, looking at some of the lessons we've learned, and looking at how we've applied these to the challenges that HEAT will face as it expands. HEAT was created because too many developing countries have ineffective health provision for rural communities. As we heard this morning, and we all know very well, nearly 8 million children are dying each year, and we know that over half of these could be saved by low-tech, cost-effective healthcare measures, such as those offered by trained frontline health workers. And of all the areas struggling to reach the MDGs relating to mother and child mortality, sub-Saharan Africa is furthest behind, where the presence of simple medical interventions could save lives, their absence is costing them. Change is needed urgently and at scale. HEAT was launched to directly address this challenge. So what exactly is HEAT and how does it work? At its simplest, HEAT is an accelerated, scalable and sustainable training program for frontline health workers that provides them with the knowledge and expertise to save lives in their communities. The theoretical materials have been written by 57 Ethiopian health experts with support from academics from the Open University. There are 13 modules representing around 450 hours of learning, covering areas such as child and maternal health, nutrition, family planning, immunization, communicable diseases, and so on. The materials are open source. They're available to anyone who wants to use them, adapt them, and translate them, and make them relevant for local context. The theoretical training is supported and balanced by practical skills training developed by WHO. This gives the workers the essential hands-on experience that they need in order to become effective health carers. So how is HEAT different? Firstly, the theoretical materials are resource sensitive. What do I mean by that? I mean that they take into account where health workers live and work. We've heard about the amazing opportunities that technology can bring. Frankly, in most of the areas that I've been to in sub-Saharan Africa, technology is still just a dream for them. They're using print and they're using practical skills that are given to them by people who are only perhaps one stage above them in terms of their own training. I'd like to just give you a couple of examples, though, how we are planning at the Open University for that technical explosion. We digitize our material so it sits on the HEAT website, and what happens is you can spit it out, if you like, in different ways. So the way that HEAT's being used in Ethiopia looks like this. Modules printed, given to the health workers when they go once a month to the health centre to get paid. They're given their module to do their next month's worth of study. In Bangladesh, we have a program which is going to reach 15 million children, teaching them to speak English. And we're doing that on a phone that costs $30, doesn't need a SIM card. We've preloaded it with 350 resources, audio, video, and text, that we've given to the teachers to use in the classroom to work with their pupils. It's a simple model. We worked with Bangladeshi authors to create the content. We can do the same for HEAT. And I've got some colleagues that I'm working with in Tigray, in Ethiopia, who gave me a slightly dodgy smartphone, actually. And what they've started to do is download HEAT content and incorporate video, some of which has come from Deb's site. And we can use this to do refresher training. You need to be connected to the internet to download the content to start with. Once it's downloaded, you can work offline. The point is the content is there and it's used and it's ready to respond to the situation that the health worker is in. Secondly, what's important about HEAT is that it's collaborative. It involves close partnerships with governments and key organisations such as WHO, UNICEF and AMREF, partners with significant experience in implementing projects at scale. And in fact, some of our partners are here today, partners who are working with us developing the multimedia materials that I've just alluded to, partners who are investing in HEAT to extend its reach and impact, and you know who you are, and I just want to say that it's really exciting working with you. Thirdly, HEAT is sustainable. Because we work with governments, HEAT is being incorporated into national strategy. So when the funding runs out for the Open University, it doesn't matter. HEAT is in country and is being used. Governments can take as little or as much of HEAT content as they want. When I went to Zambia, we were looking at all of the modules, and the person I was speaking to in the ministry said, well, we want that one and that one and that one. Is that okay? Of course, they pull out what they want, they repackage it, and they use it in a way that makes sense to them. So what have we learned in terms of the development of HEAT? One, you need to know your landscape. You need to do your homework. You need to read the relevant documents. But most of all, you need to talk to people. In Ethiopia, we probably spent about 12 months really getting to understand what the government was asking us to do, what the regional health bureaus wanted, and what the health workers themselves wanted. We looked at sector plans, and we asked ourselves, how does HEAT align with those? We asked, what are the urgent needs, and how is HEAT going to help meet those? Partnerships are at the core of what makes a strong and sustainable program. It's not just about the funding, it's an investment in a broader sense. It's about getting buy-in. Our experience has been that a government may have a strategy and it may be a very strong one, but further down the chain you can meet resistance and people will just not incorporate what you're trying to do. So it's about getting buy-in at all levels. It's about complementarity of skills. It's about fusing ideas and experience. The biggest programs need more than what one organisation alone can deliver. So collaboration is and will continue to be absolutely vital to the success of HEAT. And it's been made clear to us again and again that the technology must not drive these programs. If there are underlying problems such as poor motivation, poorly trained tutors, and students with little prior learning, then introducing technology is not necessarily going to solve those problems. And it's not just about content. HEAT has, and I'm biased, but HEAT has great content. It's relevant, it's written for frontline health workers, it's written by experts who understand their situation. It's high quality and it's something that everyone in the team is really proud of. And Vicky mentioned earlier, content is part of an ecosystem. So content is only part of the architecture for change. You need well-trained and well-supported tutors. You need a system that supports learning, and you need one that provides ongoing training and one that rewards frontline health workers for what they do. So it's almost a year since I stood here and talked about HEAT for the first time to a broad audience like this. And last night when I was doing this presentation, I was really thinking and asking myself some hard questions. what has HEAT achieved in the last 12 months since I was here? What's happened more widely in the arena of health education and delivery? Are we making a difference yet, a real difference? And sure, we have made some progress. We've had more funding, which is fantastic. Another 5,000 health workers will be on the programme this year. We are undertaking research related to HEAT and mental health in Ethiopia. We're talking with organisations about developing non-communicable disease programmes, about developing programmes in water and sanitation. And we're talking to more people like you who want to make a difference at scale. And I'm sure that it's the same for many of the projects where people have come back again this year to stand on this platform and talk about what you're doing. There have been successes, milestones have been reached, and achievements secured that represent real differences to people in terms of the quality of their health and their lives. But are we really making a difference on a scale that's needed? No, we're not. For HEAT, 5,000 more health workers this year, that's good. 20,000 in Ethiopia, that's going to be good too. 200,000, I'd start to feel happy that we were really beginning to make that difference. So I thought about the challenges. At a program level, there will always be challenges. We're all familiar with those. Finding the right partners, thinking creatively when deadlines change, when the demands start piling up, and looking at day-to-day how we react to those. For HEAT, we have a challenge. We need more funding. We need more partners who want to translate the materials. We want more video. We want to extend its reach outside Ethiopia, outside sub-Saharan Africa. But then I thought, that's what this conference is about. The point is that we are here to think about and share ideas and inspire each other to do things bigger and better. And that's very exciting. Today, globally, we are presented with immense challenges. And tomorrow, we will be presented with even more. It's estimated that 2 billion more people will be born in the next 40 years. Bold, ambitious thinking is without a doubt required on a global scale. We need people that can look into the future and create outrageously ambitious but achievable plans. People like you. Think unconventionally, be resolutely positive, and lead the field in the application of your expertise. So just finally to return to lessons learned and to finish this presentation. What I've learned is that working on large-scale, game-changing programs takes nerve. It takes commitment and it takes passion. Why? Because when it's hard, when you have just invested a lot of energy getting a lot of no's, when you meet seemingly impossible barriers, then you need to hold on to that vision in your head and in your heart. You need to dream big and don't let anyone ever tell you that it can't be done. In 2000, the challenge was set, the MDGs. Now, only 3 years away from 2015, we need to ask, are we really responding fully, and are we on the path to meet these goals? The challenge is still huge. 1 million more trained health workers just in sub-Saharan Africa. But I believe it's an achievable target if we work together, creating content, creating partnerships, constructing an architecture for professional development. Ladies and gentlemen, health is a human right, a right that currently over 1 billion people do not enjoy. It is our responsibility to change that. Thank you very much.